Well, Ebola's spread through West Africa is slowing in recent weeks, but health workers from around the world are still hard at work in the region. There's been a global push for new technology to treat Ebola patients and to protect those working on the front lines. Well, here in the UK, Renfrew Group International have designed a new Ebola patient isolation suit, and their design development director, Michael Phillips, joins us now in the studio. Thanks very much indeed for coming here to speak to us here on Arise Report. What's so interesting about this new suit, which we're going to see in a moment, is that it's actually the patient who wears it instead of those doing the treatment. Why this change? What gave you that idea?
Yes, well, at Renfrew Group, we're designers that look at problems and try and come up with creative new ways of solving them. It's a very people-centred business in that we put the human needs at the centre of whatever the problem solving is, whilst thinking of practical, manufacturable engineering solutions and so on. So the situation here is that we've looked at isolation systems with the Department of Health and the NHS for a number of years. And this suit is an approach to turn the problem on its head and say, well, actually what's been one of the major difficulties is protecting the care workers whilst looking after the patient. So how do we make sure the patient is well cared for, but give extra protection to our care workers?
I know it's in the early stages of it, and we've just seen pictures there of what it might look like. It's sort of like a space suit with a facial visor, well, a head covering. What about the practical problems of when somebody is, spiking a fever? What happens if you vomit inside that? I mean, all those kind of things. The comfort of the patient, it could get very hot in there. How do you compensate for that?
Well, quite. These are very good questions. And actually, the purpose of prototyping and this type of design work is to raise those questions, look at them collaboratively with the experts, and come up with solutions. So in posing those questions, we might say, well, we can air condition the suit. The suit can have its own environmental control, which can be done quite cheaply. In terms of caring for the patient and cleaning them, there's work being done on that at the moment. There are current methods of cleaning and looking after patients which will apply in this suit.
What are the practical things that have to happen for this suit to actually be used in the field? Could we see it being used quite soon, do you think?
It's at least 12 months away. There are other solutions that we're working on, temporary isolation rooms with negative pressure, which pop up in less than an hour. We looked at that with a big American inquiry from the Pentagon, in fact, where how could you deal with numbers, thousands and thousands of units delivered in a very short space of time. What this suit is doing is looking at the problem from a different angle and posing the questions. How are we going to deal with a bigger outbreak? What's our state of preparedness? How are we going to tackle incoming cases more than the ones and twos that have happened last time? So we're looking at that with the NHS and Department of Health more widely. A very good job was done this last time, and we've been lucky. As a nation, we've responded in the way that we best can, but there's a lot of innovation here in the UK that can be directed to solve lots of problems like this.
Well, we wish you well with the project. Thanks very much indeed for joining us.
Thank you.